I'm joined by Lisa Layton, Patient Access Manager at BAMF Health. Lisa will be presenting on a panel discussion related to prior authorization during our upcoming Patient Access Program on July 18th. Lisa, thanks so much for joining us today.
Absolutely.
So to get started, if you could share with us a little bit about your background, how you got your start in healthcare, your current role at BAMF, and also maybe just a little bit about BAMF Health, just for those who don't know a lot about the organization.
Certainly. So I started my career in healthcare when I was a teenager. I started my first job working in a nursing home, and truly that love for caring for patients began at that early age. I knew right away I wanted to go into healthcare after school, went to college, didn't quite want to do the clinical aspect of it, so I found the administrative side to be where I thrived and where I truly felt challenged and valued. I have worked in outpatient therapy setting and then moved into working in a urology office, worked very closely with a physician there who was one of very few in the state of Michigan who did the robotic prostatectomy. So I worked very closely with his prostate cancer patients. And that is what brought me to BAMF Health. BAMF Health is one of the world's leading experts in theranostic treatments for cancer patients, especially those in end stage of metastatic disease. Our approach here focuses on intelligence-based treatment for each individual patient. Our state-of-the-art platform allows us to see what we treat and treat what we see. We help patients spend less time in hospitals and feel better faster and simply get back to living their life. We have molecular imaging clinic with one of only Michigan's only PET MR machines, and we also have a PET CT machine that is one of very few in the United States. So very excited to work here and continue that work with cancer patients, and BAMF Health is definitely setting the bar very high here.
Definitely, and I think it's such a wonderful thing to hear that you started your career in healthcare at such a young age. You're actually the second person that I've talked to today, the second one of our panelists who began working in healthcare at, in their high school years before even going to university. And I think that it really shows that desire to help others and to help patients feel better. We're really looking forward to having you on the panel focused on prior authorization. And one of the reasons that we wanted you to join the panel is that the procedures and the treatment that BAMF is providing is so complex and really kind of ratchets up those prior authorization challenges. Could you share with us just one area that your team is working on or that you're working on improving when it comes to prior authorization?
Certainly. It is definitely a challenge, especially with newer FDA-approved cancer treatments. That has definitely been a challenge here, especially when these new treatments don't have their own procedure code yet. So we're dealing with that unlisted procedure code and finding out what those NCCN guidelines are, what FDA has approved this treatment for, and being able to give those insurance payers the documented proof that they're looking for, saying, hey, we've done our background work, they have met the criteria, this is the next step in their care, and here it is for you. So we have worked really hard to establish those guidelines and know those FDA criteria in order to get this treatment approved. And when it is denied for reasons that don't meet medical criteria, we're able to go back and say it does truly meet it, and here's why, and here's the guidelines that we followed to get the patient to this point in their care. So it definitely has its challenges, but it's very rewarding to be able to get that approval and know that this patient can get the treatment that is going to better their life.
I can imagine, and I think that our audience is going to absolutely love hearing from you. We've talked a lot about unlisted codes and the challenges and the documentation requirements, and your experience in that area I think is going to be such a valuable addition to the panel. For the patient access meeting, is there anything specifically that you're looking forward to discussing with peers or to benchmarking during the program?
I think really just connecting with others who are in the same position that I am in, and also those who are struggling to get those prior authorizations, and help share the things that have worked for us and what has helped expedite those processes to get that approval on the first time and not have to do those appeals or those peer-to-peer. So really just looking forward to talking with others who are in the same field and sharing struggles that they've had and helping others get past those struggles.
Well, we really appreciate you coming on today, and we look forward to the program in July.
I am looking forward to it as well. Thank you,
Thanks
Kate.
so much. Thank you.
Absolutely.